Hi, my name is Rachel Knotts, and this is my PRaISE presentation poster. So I did mine on Huntington's disease and positron emission tomography. And I am also a certified nuclear medicine technologist, and I currently attend the College of Allied Health Sciences at UC, and I am in the Advanced Medical Imaging Technology program. So, to give you a little background on Huntington's disease, so this disease is a neurodegenerative disease that has a late onset and it primarily affects motor functions. And it does take a psychological toll on the body since it really just um, breaks down all the muscles in the body. And there are lots of symptoms, but the main ones include changes in behavior, irritability, there's some mood swings too, and also very much of a difficult in controlling movement. That is the key one. So, um, what really occurs is that there is a gene mutation, and that occurs in the protein gene Huntington, and that is what just gives all the symptoms in Huntington's disease. But there is genetic testing that is available, as well as medical imaging that can help in the diagnosis and prognosis in this disease. So, when it comes to medical imaging, nuclear medicine is a great tool. So, this is a modality of imaging that uses radioisotopes through IV access that allows there to be an evaluation of the function of organs in various regions of the body. So, here we are going to take a look at the brain in Huntington's disease. And some of the radioisotopes that are used are 18F fluorodeoxyglucose, also known as 18F FDG, and also C11 RACLO. And these are used in positron emission tomography PET imaging. And this is used to obtain scans in the brain to help assess the staging of Huntington's disease. So there was some research done, and the two main structures that control the motor functions include the caudate nucleus and the putamen. And yeah, again, they control the cognitive and motor functions in the brain, is what the key factors that they play. So, PET imaging can identify how well those structures are working based on the uptake of 18F FDG and C11 RACLO radioisotope uptake in the brain. So down below, you can just see those are the two structures in the brain that are just right next to each other that control those motor functions. And based on how much of that isotope uptake there is on the scans determines how well those structures are functioning in the body. So a PET study was done to evaluate the metabolic patterns in the brain in relation to the caudate nucleus and the putamen. And both symptomatic and asymptomatic patients were used in the study that have that HD carrier. And basically, the point of this is to see if there's any difference in the radioisotope uptake in comparison to the controlled subject. And based on the findings, the PET Huntington's disease study revealed that there was a drastic decrease in that 18F FDG and RACLO uptake in the caudate nucleus and putamen in the brain. And that finding was found in the symptomatic patients. And from the study, there was also a slight decrease in that uptake in the brain for the asymptomatic patients as well. So there both seems to be a decrease in uptake. So these same patients were rescanned years down the road after this disease is still in their body as it is continuing to worsen over time, because that's what happens with this disease. And based on more scanning that was done years down the road, there was found to be an overall function reduction in the striatum. And the striatum is just a combination of the putamen and the caudate nucleus. So there was a percent reduction in that motor function in the brain. And based on these findings of this research, this can conclude that PET scanning is a useful tool to help evaluate the prognosis of Huntington's disease in the brain. So really the purpose of just PET imaging, just in general and specifically for Huntington's disease, is just to find out if this type of testing qualifies to help in the staging and prognosis of this disease. And that is because that is not the first choice when it comes to testing. Usually genetic testing really is the first step. So just really seeing how accurate and well this type of testing would help for this disease. And also, so medical imaging can be another tool to help in the HD findings based on the information from the patient of their family history and the symptoms can determine where their staging is at with the research that can be done. When it comes to the equipment, so we have a scanner. There's a Positron emission tomography CT scanner. And this is a type of nuclear medicine scanner. And this uses specific radioisotopes that I mentioned earlier. And those isotopes emit gamma rays from inside the patient that go onto the scanner. And that is how the data is collected for the scanner to acquire the images. And these results of the high sensitivity in the scanner is what plays a huge role in PET imaging. So while you might not be able to see the actual structure super well, you might not be able to see the anatomy well, it might not be a specific finding, but it is very sensitive in determining if there is a decrease in the working of the function in the body. And that is what makes PET imaging so vital and important in this modality. So there is definitely a downfall when it comes to this type of research. So Huntington's disease is one of the more rare types of neurodegenerative diseases. And because of this, there have been fewer research studies done on this disease in comparison to Parkinson's disease, that is a more common type of neurodegenerative disease. So that has more research studies done on it and just more information. So there's that. And because of this though, and with the technology we have now with PET imaging and the equipment, there can be more Huntington's disease imaging done moving forward, just because we do have new tools and we have great PET scanners that have a CT attached to them. And this has been going on for now 4 decades of the scanner evolving. So that can be used just moving forward with this type of research. And in conclusion to all of this, just being aware of the symptoms of Huntington's disease can help in the testing of the prognosis of Huntington's disease. There are just lots of different types of symptoms, but just even starting with getting genetic testing can help move forward just so that there can be treatment plans ready and available for the future for the patient. And PET imaging is an advanced test, not only in general, but specifically for Huntington's disease, that can help determine the function and sensitivity of the striatum in HD patients. And lastly, based on the research that was done, there have been positive correlations that have been found in PET imaging with 18F, FGG, and C11, RACL, and HD research. So thank you for watching this presentation.